Welcome to the UH Sports Medicine Virtual Marathon Q&A. My name is Pete Kenworthy. I'll be your moderator today. A couple of housekeeping notes before we get started here. We want you to know that in order to ask a question, to type your training and related health questions into the Q&A. You'll see it at the bottom of your screen there. There's a box that says Q&A. Go ahead and click that, open that box, type your question in there, and click send, and then we'll be able to see your question and get those answered by our panelists today. If you have any questions about the Rite Aid Cleveland Marathon, the virtual race, or registration questions, you can go ahead and send those to joan@clevelandmarathon.com or send those to cmi@clevelandmarathon.com. And we want you to know also that a recording of this webinar will be made and it will be available at clevelandmarathon.com/university-hospitals. That'll be done at the conclusion of this webinar. So let's go ahead and meet our panelists for today. On your left there, you see Dr. Amanda Weiss Kelly. She's chief of the Division of Pediatric Sports Medicine at University Hospitals Rainbow Babies and Children's Hospital. She also serves on the American Academy of Pediatrics Council on Sports Medicine and Fitness since 2004, and representing the AAP to the Female Athlete Triad Coalition, an international collaborative group dedicated to promoting the health of female athletes. She's also a member of the board of directors for the American Medical Society for Sports Medicine. Dr. Ben Boswell in the middle is a specialist in sports medicine and an assistant team physician for the Cleveland Browns, board certified in emergency medicine with a certificate of added qualifications in sports medicine. In addition to taking care of athletes, he also takes care of our U.S. Army soldiers, currently serving as a captain and physician in the U.S. Army Reserves. Dr. Boswell has participated in running events like 5Ks, 10Ks, 15Ks. He's also an annual runner in the Army 10-miler run in Washington, D.C. And finally, Tim Pugliese is a physical therapist who has worked in outpatient rehab for 20 years, currently working for UH at T3 Performance in Avon, seeing patients with a broad range of musculoskeletal injuries with an emphasis on sports rehab. He's a board-certified specialist in orthopedics and holds certifications in sports rehab and manual therapy. Also, Tim is an endurance multi-sport athlete, having completed 4 marathons, numerous half marathons, enjoying trail running, road cycling, mountain biking, and has also completed triathlons up to half Ironman distance. So 3 qualified panelists here to answer all of your marathon questions today. So guys, thanks for being here with us to answer all these questions. Let's get started with the one that everybody seems to be asking these days to kick it off here. And really it's, do I need to wear a mask while I'm running outdoors in my neighborhood? What should I do to protect myself during this pandemic? Don't be shy.
Oh, okay. So I'll start. Yeah, so, it's a really good question. You see a lot of runners with masks. You see a lot of runners without masks. Generally, it's all about social distancing. So, me personally, I think I would have a very difficult time running with a mask. I would have a very hard time breathing. So I would personally suggest against it. The important thing is just keeping yourself separate from other runners. Some will say, well, if you run right behind another runner, their air can kind of enter the area that you're breathing. Yes, that's true, but really as long as you keep 6 feet of distance between you and other individuals out exercising, you should be pretty safe.
All right, well, let's kick it off with the questions coming in here. Monica starts us off here with asking if you can give advice for IT band syndrome.
Go ahead, Tim.
Okay. Yes, IT band syndrome is one of the more common running injuries. Often presents down on the lateral or outside part of the knee. There are a number of factors that can contribute to that. Oftentimes after running on a banked road where the roadway is uneven, so one leg is higher than the other, can contribute to that. Also imbalances in both flexibility and strength in the hip musculature. So if this is a new problem, the best thing to do is take a little bit of rest, maybe just a couple of days rest, doing some ice or anti-inflammatories if you are able to take them medically, and then really working on your flexibility to address any restrictions in your flexibility and working on strength. Commonly we see weakness in the hip muscles of runners. So doing lateral band walks with resistance bands or doing side planks, some of those type of exercises to really work on that lateral stability of the hips as you run so that your hips stay more level, especially with fatigue with longer distances.
The only thing I would add to that is if you've recently added biking to your cross training regimen, make sure that your seat isn't up too high. Sometimes if your seat is up too high, that can irritate the IT band as well.
Great. Question here from Holly, which is probably a common question. How do you choose your best marathon training program? She says she's done half marathons in the past. She's overwhelmed by all the variety of training plans out there.
That's a great question. And unfortunately, the answer is a little tricky because it's very individualized. So some people will do great with Runner's World, probably about 10 years ago, put out a 3-day-a-week training program where you're only running 3 days a week and cross-training on the other days. And the vast majority of people they had on that program actually improved their times compared to previous programs where they were running 5 days a week. But some people will need more or less mileage to run their best marathon. And so some of it is a little bit of trial and error and what works best for you. If it's stressing you out and making it difficult for you to keep up with your program, with your lifestyle, then probably that's too many miles. If you're getting a lot of pain, it's probably too many miles. But if you don't feel like your time is improving, you may need to add speed work or more miles.
All right. Question from Bob. Says he's going to run the Akron half and the Cleveland full next year. What's the best? How does he get his run times faster while not hurting himself at the same time?
Yeah,
I think
oh, sorry. Go ahead, Tim.
I was just going to say, yeah, definitely cycling your training throughout the year and through the running season, trying to peak at those times for your kind of A or your key races for the year, and then allowing yourself some recovery time to then get back into a training cycle for that next event. You may not want to stay at that same level of, 45 miles a week or whatever you choose to run throughout the year, but really doing some periodization to your training. And also incorporating some cross training, and then also not just always going out and running the same pace, but adding some speed work, adding some different interval or tempo runs to really mix that up. And that's how you get faster. If you just go out and run the same speed and kind of a steady run every time, you get really good at running that pace, but it's going to be hard to get faster unless you incorporate some of those faster workouts or interval or speed workouts.
Sometimes picking a faster running buddy will help with that because you don't have to work so hard to think about it. You just try to keep up with your faster running buddy.
Yeah, and I was just going to say almost the same thing as Tim was going to say. It's really important to not just to go out and run the same thing over and over and over again. It's really important to do a lot of cross training just to keep yourself from getting burned out. And I think that's really helpful, and it also helps building core strength and things like that. It will make you will increase your speed as well.
Our next question in the Q&A is actually a marathon question, and we don't have someone from the marathon on this. It's asking if times can be submitted through that final day. I know you're allowed to run the marathon through May 17th, so I would assume you can submit your time then. I will say we put up an email at the beginning of this webinar, and we'll put it up again at the end if you want to confirm that through one of those email addresses at the end of this webinar. Question here from Laura says she's an experienced runner, hoping to run her first marathon in the fall, but she's had meniscectomies, I hope I said that right, meniscectomies in both knees. Any suggestions on how she can train safely? I believe I saw this come in earlier, and I think it's the same person who says that she's run half marathons previously.
Yeah, so I think the important thing to realize is once you've had meniscectomies, you have altered the natural mechanics of the knee. So the biggest thing is, yes, you will cause additional stress to your knee. The biggest part about that is you have to let pain be your guide. If you're running to the point to where you have to take anti-inflammatories to ease the pain after your run or other pain medications, or if you're having to take pain medications or anti-inflammatories to run, you probably need to dial it back a little bit. So you really need to let pain be your guide. Being active and weight loss is of all the things we found for knees with arthritis or meniscectomies is the most beneficial thing. So you certainly don't want to stop, but you kind of have to let pain be your guide and adjust your training based on that.
I agree, and I would just add that cutting mileage and maybe not staying strict to a training program that maybe you would have typically used. And if you are an experienced runner with doing half marathons, you probably have a pretty solid base of fitness. So you're okay to cut back on that mileage, and you'll still be okay to do a longer distance event. But I think incorporating some exercise that is less loading and just pounding through the knee is helpful. The weight loss, like Dr. Boswell said, and then also staying strong. The more muscle you control, the more muscle control you have around the knee and neuromuscular stability will help some of that loading or compression in the joint. So incorporating strength training is important.
I have another knee question here, and then we're going to get to a back question and then a foot question. So get ready for those. The question from Jan here is that her knee is hurting on the inside when it's laid flat. Says she's been resting it and icing it for over a week. Any advice to get her back to running?
So yeah, I think just laying off for a few days and allowing it to rest is important. There's several structures on the inside of the knee that can be painful. If it is when it's fully extended, it might be some of the muscles that cross both the hip and knee. It could be a hamstring or adductor flexibility that's a problem. Incorporating some soft tissue mobilization with rolling with a foam roller or massage. Definitely doing then a nice active warm up before getting back into running, and also just staying active to try and keep those muscles loose and not just get tight. If you lay off too long, you're gonna just have that same tightness when you go back into running.
Okay, back injury question here. Long runs, especially marathon, ultra distance, put stress on the lower back. What exercises do you recommend for safely strengthening your lower back to help prevent that injury?
So yeah, that's a really good question. A lot of times with low back pain, especially with running and most activities, really it has a lot to do with hamstring tightness. So if you have tight hamstrings, you often develop low back strain and pain. So it's really important to do exercises to work on not only strengthening the hamstrings and quadriceps, but also stretching the hamstrings. It's very important when it comes to running and low back pain.
And I would add some neutral core strengthening exercises. I'm a big fan of planks, side planks, and you can make side planks and regular planks harder by lifting up one leg, which forces you to incorporate the low back a little bit more. I don't necessarily love crunches or sit-ups. I think sometimes that can add strain to the low back.
If I can also add, so not only do we look at the area where the pain is, but also looking above and below. So the flexibility of the legs is important. Looking at some of the trunk mobility. If someone has a very stiff thoracic spine, there's less shock absorption through the spine, and it is all then centered in that lower back. Also, hip flexor flexibility. If someone is unable to extend their hip, their low back will hyperextend more, getting more joint compression there. So really looking at, again, a good overall flexibility, good balance of flexibility in the different muscle groups. I agree that the core strengthening is really important. You can do it with some of the static holds, planks, and bridges, but also functional movement. So doing lunges where you're keeping the abs tight and trying to maintain that neutral spine position and not allowing your back to go into that hyperextended position. It's really important to train your body with movement, how to maintain that neutral spine. It'll have less compression than when you're running.
That's great. Ted says he's a half marathon runner, has been running for years, but recently has experienced intermittent numbness in the front part of one of his feet. Any thoughts on what could be causing that, and are there stretches or other things that could help it?
So numbness in the feet can come from a number of areas. It can be coming from the low back. It can be coming from a peripheral nerve entrapment somewhere in the leg. Some of the things that we just talked about with the person with low back pain, but looking at flexibility and more core strength to maintain that neutral spine position. But then also looking at just flexibility down the chain. So at the ankles, is there some mobility restriction in the ankle that we can work on loosening ankle mobility? With some neurological symptoms, you want to be just wary of, is it just a slight numbness, or is it become more significant where you're losing any muscle strength? If your reflexes or some weakness in the leg, then it's more concerning the more neurological signs you have besides just a little bit of numbness or tingling.
I agree. It's good to watch out for weakness. Sometimes I have had issues with that, and it's been as simple as changing the way that you're tying your shoes. If you tie the shoes too tight on top, sometimes you can get a little peripheral nerve compression. or if your shoes are worn out and so it's changed the position of your foot in the shoe, sometimes that can cause some numbness, but that shouldn't cause any weakness. So I agree, it's really important to look for weakness too.
All right, let's move on to Louise's question. Says she's been training well and suddenly developed knee pain inside the knee that then turned into slight swelling with a bump above the kneecap on the outside. I hope you followed that. Slight swelling, let's see, knee pain inside, slight swelling with a bump above the kneecap on the outside. She's asking, how do I know if it's meniscus, IT band, MCL? Says she's resting and it's killing her, but she's also been icing it.
So, it's tough without seeing individually or specifically, but, anytime you have medial knee pain and from what she's describing, it kind of sounds like she might actually even have an effusion of the knee or swelling in the actual knee joint itself. So then I would be a little more concerned about a meniscus or an injury inside the knee. So, I would try to rest, use some ice elevation and see if it improves. If it doesn't improve, she probably needs to have an evaluation because I would be worried about that.
Okay, Tim says he's a consistent runner who runs 4 times per week, roughly 35 miles a week, which is about 35 more than I run in a year. So nice job, Tim. He says he's run 5 marathons thus far. How long should his marathon training cycle be? He started at an 18-week marathon training program, but he's reduced it to 14 weeks. Is fewer weeks better to avoid overtraining and maybe establish a 10 or 12-week minimum plan?
I think, kind of what works for your lifestyle and kind of what you feel like you need. Everyone responds a little bit differently. I don't think there's anything wrong with having a longer training program, especially if it's gradual and ramps up. I don't think you're any more likely to lead to overtraining that way. I think sometimes if people try to do too short of a training program, I trained actually 7 weeks for my first marathon, and I don't recommend that to anyone because then you're definitely overtraining. You're ramping up way too fast. So a gradual program and doing manageable distance is good. I think allowing recovery time before that next cycle starts is important as well. Just to let you're not just maintaining that same high intensity or volume of training year round.
Yeah, and I would add to what Tim said is, and there's a common theme we've all been saying, but what's really important is cross training. Cross training helps to alleviate from overstress injuries from running too much or ramping up too much, and it allows your body to rest with maintaining cardio and strengthening. So, I would definitely suggest incorporating more cross training to help with that as well.
You're saying other ways to get the cardio, like biking, things like that?
Okay. Yeah, biking, elliptical, things like that.
Okay. All right, Neil has a question, says he's a beginner runner. What pain and aches could be indicators that it's time to replace your running shoes?
So a lot of times they'll use mileage as a key for running shoes. So you say about 300 miles. I think it depends on your body structure a little bit, how hard you are on your shoes, and also the type of shoe that you wear, if you require a more supportive shoe or not. Some people, like I can actually tell my legs start getting a little more achy, my knees get a little bit more achy when my shoes are worn out, and then I know it's time to replace them. As far as timing now with the race, you never want to get a new pair of shoes and then go for too long of a run in it or try and do a race right away. You want to make sure you break in and adapt to that new shoe. If it's the same model you had been running in, you just get the update. Maybe that's less significant, but still it is going to have different support than what you are wearing. So just giving yourself time to adapt to that new shoe is important.
Okay, anonymous question here. Your thoughts on using gels and energy drinks during long distance runs, training versus races?
Well, one of the big rules of thumb put out by the American College of Sports Medicine is that if you're running for less than an hour, you probably don't need extra carbohydrates for that workout. But if you're going to run longer than an hour, it can be helpful, and it helps people avoid that, what people describe as hitting the wall. And they're usually made to be easily digestible, so they're less likely to upset your stomach than other kinds of foods. So I think if you're running over an hour, it's probably reasonable to use gels or a carbohydrate drink.
And I'd just like to add into what Dr. Weiss Kelly mentioned is that, you know, the energy drinks, if you're doing the energy drinks, just remember what kind of energy drinks you're using or carbohydrate drinks you're using. A lot of them have really high sugar, which is really going to irritate your stomach. And if you notice you have issues with that, if you're drinking Gatorade or Powerade or any of the other sports drinks and you're noticing some GI discomfort or stomach discomfort, it's always nice to mix it with water to try and cut down on that sugar content, or just simply go with a sugar-free or light drink, as that can irritate your stomach when you're running, which is problematic.
And another practical point, they've actually done some studies that show that distance runners get more cavities than other people, so brush your teeth afterwards.
Interesting. I heard that one. All right, interesting question here from Olga, who says she has trouble with her stomach after she's done running, and only for longer distances, like over 3 hours. So she's usually okay while she runs, but about 30 to 60 minutes after, she'll throw up repeatedly and then is worthless for several hours. She says some races, though, she has no trouble, and other times this does happen. She's tried varying like how much she eats before and during the race. What else might be causing something like this?
Well, I think it's important to kind of structure your eating pattern leading up to a race. I think having good intake the several days before, not doing too much of a carbo load right before. Typically, they say an average diet should have 45 to 65% carbohydrate. The few days before, you might up that to maybe 60 to 70%, so a little higher than what you were taking. And then eating your meal a good 2 to 3 hours before the event to allow digestion to occur for any solid foods. Within maybe 15 to 20 minutes, you can take a carbohydrate drink and drink a little bit before the event, but you want to have that time for digestion before, and then really stick with some of those easily digestible goos or gels during the race. And you have to find which ones work better for you. I've worked with a lot of different athletes where some they just don't tolerate and others are fine. So it's a little bit of trial and error for what works for you, but I think staying hydrated and really paying attention to your diet even a few days before the event is important.
And another thing to think about, some people will pre-medicate before long runs with anti-inflammatory medicines because they're worried about getting muscle soreness. And anti-inflammatory medicines can really upset your stomach with long runs. So if you're doing that, I would stop taking anti-inflammatory medicines prior to long runs. And I agree, making sure you're hydrated, not just the day of the run, but several days ahead of time, because when you run, your body will take blood that's usually going to your stomach and other internal organs to send it to your working muscles. So for that period of time, the stomach's getting a little less blood flow than normal. And if you're not well hydrated, it's getting even less. So that can certainly contribute to that stomach upset you get afterwards.
We have about 6 questions left and about 7.5 minutes to get to them. So let's see if we can get to all of them here. Bob talked about switching to running to the Vibram 5 Fingers 6 years ago, those toe shoe things. He asked if you're familiar with barefoot running, said the experience is no knee or back pain and loves it. Just wanted someone's thoughts on it.
Absolutely, it's something that works for a lot of people. You need to, if you have been a person has been doing that for several years, then they've kind of made that change in their running form. I just warned someone about making a dramatic change from a regular running shoe that does have a very cushioned heel into more of a barefoot type running, because your gait will change, and that's something that you have to gradually train over time. So there are some schedules you can do, but transitioning some runs with barefoot, somewhat with the running shoe, and working your way to more of the time with the barefoot running, because it will change the way you impact the ground.
It was my mistake. Our first webinar was 30 minutes, and this one's scheduled for an hour. So we have plenty of time to answer all the questions. Any other thoughts on the barefoot running? Anybody want to take a stab at that? We'll just move on. All right. Anonymous question here about running with bunions. Any thoughts on how to help minimize pain?
Well, yeah, it's kind of tough because what you can try to do is you can try different shoes to see kind of what alleviates. You want to use more wide toe shoes to kind of alleviate the rubbing on the bunion itself. That's probably the best suggestion I would give for that. It's kind of tough. It's very hard to run with bunions, but that's probably the best thing to do is get a wide face shoe or wide soled shoe.
I agree. The other thing you can look at is why have you developed the bunion? And so there's some mechanical issues with your gait that have caused the person to push off more the inside of the foot. And so looking at ankle mobility, foot mobility, that changes the mechanics and puts that stress on that joint. That's something that, you can, we treat all the time in therapy. And a lot of times we can deal with restrictions up the chain in the ankle or foot that can put less stress and less of that medial push off or pushing off the inside of the foot versus going straight over like the middle toe of the foot at push off.
Here's a great question from Bob for someone who leaves Ohio to run in their marathons. He says, any tips for running a marathon in heat and humidity when your training is not in the same heat and humidity?
Yeah, that's tough. That's tough, especially joining from Ohio to go to a high humid areas. The biggest thing is going to be increasing your hydration when you do those runs. Another thing you can try and do is run with numerous layers when you're here to try and simulate the heat. But the important thing about that is you also want to wear layers and remove layers if you get too hot. It's hard to do, but the biggest thing is as you transition to make sure you're well hydrated.
And if you have the ability to do it, if it's a big race and you can show up to that place a couple days early, adults acclimatize fairly quickly to the heat and humidity, and kids are a little bit slower. But if you can make it a vacation and show up 5 to 7 days early, that can help too.
Okay, question from Stephanie asking about any recommendations on making the transition from the marathon to the ultra marathon to avoid injuries.
Yeah, that's a big jump. I think someone that has a solid base of running is more well prepared to do that. There are, obviously training programs for those distances as well. One of the things I think is really important for some of the endurance stuff is paying attention to intake. So the appropriate foods and liquids just to be able to handle that kind of distance and that kind of energy expenditure is really important. Anytime you're doing a longer event, whether it's an ultra marathon or someone that's going to do an Ironman versus shorter triathlons, the energy just becomes that much more important and really paying attention to getting appropriate intake. The other thing is just having the right strength. The longer you run, the more that you're going to fatigue, and so form breaks down. So like we've talked about multiple times today, cross training and incorporating some strength training is important. So you can't neglect that side of it, even though you're going to spend a lot of time running in your training program. You have to set aside that time. It's very important to have the time to incorporate the strength training as well to help maintain your form and mechanics for those longer distances.
Okay, Kathy is asking about nutrition recommendations for runners training for half or full marathons.
I think it's important to make sure you're always getting in enough calories to compensate for the exercise that you're doing. Typically, adult women, depending on your size, need around 1,800 calories or so a day just for sort of existence. And then an easy calculation is about 100 calories for every mile. If you limit your calories too much, it can affect your bone density and it can increase your risk for stress fractures and osteoporosis later on. So being careful to make sure that you are adequately giving your body the calories that it needs for the energy to do these events is really important. And that's even more important in adolescents because they're still building bone. And so if they're not getting in enough calories to compensate for the exercise that they're doing, they may end up with a lower overall bone density as adults.
All right, question here from Mark saying he hears that runners often have lazy glutes. Can you speak to the importance of strengthening your glutes? He says he understands that, I think it's pronounced Kipchoge, who broke the 2 hours in the marathon, makes glute exercising or glute strengthening exercising a priority.
Yeah, the glutes are very important, and often we see people have very weak glutes. I've worked with elite athletes where I have them laying on their side and raise their leg, and I can push it down with one finger. It's amazing how weak they are, even though they are very fit. But they've just neglected that aspect. And the hip strength helps with the lateral trunk stability, keeping the pelvis level when they run, which is really important for the biomechanics affecting the lower extremities and the low back. Some people just have those muscles are really inhibited. They don't activate them very well. So doing exercises that really target those muscle groups is important. Lunges, I mentioned before, sidestepping with a band around the ankles, or even leg lifts on your side planks, hip hiking. So if you're standing on one leg and kind of hiking up the other hip, all those are really effective exercises at targeting the glutes, which are important during the gait cycle.
And I agree with Tim. I just wanted to add that I think, at least from my experiences, weak glutes are very, very common. Most patients I see with low back pain, hip pain, knee pain, the vast majority have weak glutes. So I really want to stress the importance of doing the glute strengthening and training that Tim had spoke about, because it's very important, and it causes a lot of issues with hip pain and back pain.
Okay, Mary says she's had random issues with really bad calf cramps, and she doesn't know why. She said she's made sure she's totally hydrated, so that's not it. She's tried taking magnesium. She says she's tried all the things people have told her to try, and sometimes it hits, sometimes it doesn't. Can't figure out why it's happening. She says her calf muscles will literally jump, and it's painful enough that she just has to stop and walk. She says it usually happens between 9 and 10 miles, if it happens. She said for a half, that's okay. She can just walk the rest, but not for a full marathon.
So there's a number of factors that can contribute to that. Proper footwear may be something that you should have looked at. She's tried different types of footwear. Going to a kind of running store, specialty store, can help kind of find the right shoe. We treat that in therapy, and again, looking at the balance of strength and flexibility. So are the calves tight? Is the ankle mobility limited? When the joints don't have as much motion as they should, there's more stress on the soft tissues. So that might be something that is just consistently there, and until that's addressed, she's going to have that likelihood to cramp. And then, like we've talked about, just the intake of like a carbohydrate or something, so that she has the energy stores in the muscle glycogen gets depleted, and if you're not replenishing that during the exercise, you're more likely to develop cramping.
And runners often will adopt a low salt diet to be more healthy. And sometimes cramps can be related to not getting enough salt as well. So that's another nutritional thing to think about.
Here's someone who says they've been running for 35 years, has run many marathons and half marathons, and just returned to long distance running after a few years of running shorter runs, and is finding it challenging. Says they're dealing with a lot of leg fatigue and find their legs are exhausted at the end of 8 or 9 miles at a slower pace. How do you get past that fatigue and achiness?
I think the gradual training program is good, and maybe adequate rest days in between. Just trying to follow a strict program that maybe just doesn't work for you. It can be too much. So trying to have more rest days after the longer runs, and just maybe she has to be a little bit more gradual with building up those longer distances than some people are able to.
And like we've said before, cross training and strength training, so that, you know, the underlying muscles are as strong as they need to be to do those distances.
Anonymous question here asking about blood in urine after very long runs. It happens infrequently, but it does make this person worried. Any thoughts?
Army guy Ben.
Yeah, so it's not terribly uncommon, believe it or not. So, you know, the question is, you know, it's a hard question to answer without more information, but really it depends on how frequently it happens. You know, we do naturally have a small amount of blood in our urine after long runs, just because of the physiology of what we do, and actually the banging of the force of the feet on the ground. But if it's a large amount of blood, and if it doesn't clear, and when I say clear after, you know, one void of urine or two, it should clear. If it doesn't clear, if it's bright blood, then you probably need to see a physician for an evaluation. But it's not terribly uncommon, believe it or not.
Blisters and black toenails. Do you pop them or drain them or leave them alone?
You never want to pop blisters. It's just an area for infection to enter the body. Commonly when we see people with black toenails, it's their socks or their shoes or both are too small. So they probably need to go up a size in those because they're just literally banging the end of their toes against the front of the shoe or even the socks that are too tight. But no, you never want to pop a blister.
Frank wants to know if you can talk about different foot strikes, heel, mid, and forefoot. Is there any benefit to a change from what comes naturally?
There is a benefit. We're finding that midfoot striking is more efficient, and somewhat everyone has a different running pattern, and you can't totally change how they run. But some of the problems we see with running injuries is that people overstride, and so they're really taking a long stride out, hitting the heel, and it creates a greater ground reaction force. So that force just going up through the leg into the body, so that can lead to injuries anywhere in the leg or into the low back. So their strategy is to help limit that overstriding. One thing is just paying attention to cadence, so counting how many times your foot strikes in a minute, trying to increase that. 90 per minute, like per leg, is kind of the ideal. It's pretty hard to achieve, but you can just count, for 30 seconds or for a minute how many times your foot strikes the ground and try to increase that as you go. That's one way to, one strategy to try to minimize that overstriding and minimize that ground reaction force.
All right, Jan asks, says she's done multiple half marathons, but she's found her endurance really low and struggling to build it up again. Other than speed or interval training, is there any other advice to help her build up that endurance again? Any foods to recommend too?
Again, I would make sure you're getting an adequate number of calories, but also making sure that you're not iron deficient. Again, a lot of runners will adopt vegan or vegetarian diets in an effort to be healthy, but then if you're not getting in adequate iron and you end up anemic, it can really affect your performance and even your mood. You can feel more depressed, definitely more tired, and it significantly affects your endurance as well.
The question from Heather asks about your thoughts on fat-adapted running.
So something is trying to utilize more fat as an energy source than like carbohydrates and glycogen stores, with the thought that then your ability to have a greater endurance is more effective when you're not going to deplete those glycogen stores. It's pretty hard, even for very, very elite athletes, to change that utilization to fat quite as much. And you can try by really intake of healthy fats is the important thing, of utilizing healthy fats in your diet. But still, the majority of your energy is going to come from carbohydrates during any kind of athletic activity, especially the endurance stuff.
Okay, Holly has a question. If you complete distance runs with a combination of walking and jogging, is there a max time you should stop during training? She says she's projecting about 7 hours for her first marathon and doesn't want to exhaust herself during training. Or is there a mileage she should top out at instead?
I don't know that it's necessarily a mileage to top out. I think if people that utilize that walk-run strategy, it's really effective for them to be able to complete more of a longer distance event. And that's fine. It could take longer, but they're at a intensity level that works for them. And so I think as you do it gradually, and that's the way you train and kind of prepare for how you plan to race, that can be effective. And I don't know that there has to be a cap to that, as long as it's gradual and strategic in the progression.
All right, Neil asks here, what is a proper warm-up and cool-down for longer distance runs?
So, probably a good rule of thumb for warming up is actually doing light exercise, breaking a little bit of a sweat, and then doing some stretching exercises there. So a common theme you hear is you're not ready till you're sweaty. Is you want to work out, then do some stretching. Stretching's a lot more effective once you're warmed up quite a bit. The biggest thing about cooling down, especially if it's a hot race, is you really want to get into a shaded area, get some hydration, get some calories, just to kind of calm down a little bit. Not so much pertinent since it's the virtual marathon, but a lot of times you see runners will cross the finish line and then just stop. that's not the best way to do things for a couple reasons. One is you kind of plug up the chute. Two is if you're using the cardiac output from the venous return from your legs when you're running, and if you just stop, a lot of times you'll get lightheaded, and some runners will even pass out because they lose that venous return and they lose that cardiac output. So it's very important to continue. You can stop running, but to continue to walk, slow down, get to a cool area, and get hydrated.
I can add to that. The longer event you're going to do will typically be a lower intensity. So it's okay to do a shorter warm up for that type of event. If you're going to be doing the 5K or 10K where you're doing a higher intensity, you will spend more time really warming up and being ready to go at that higher intensity level. For the recovery, just like Dr. Boswell said, it's important to take fluid in right after. Really within 2 hours, you want to replace the extent of weight loss through sweat. It's important within that 2-hour window, and also taking in carbohydrates and proteins within about 30 minutes from the event. So yes, the stretching, cooling down is important. And then also just replacing what you've depleted during that workout or race.
Okay, it's a great thought here from Ted. Kind of keeping track of the kinds of questions that are coming in. Wondering what types of services you guys offer at UH. Seems like there's a lot of questions here about pain, suggesting maybe we as runners are coming to you guys too late if we come by the time the pain's there. Are there like training programs, consultations? What kind of things do people come to you guys for?
Well, I know I've sent people to Tim and one of his partners, Ben, to do what's called a video gait analysis, where they can put you on the treadmill and analyze your gait pattern, your how many foot strikes per minute you're getting, and whether or not you look like you're like we talked about butt muscles a lot, whether your glutes look like they're fatiguing while you run. And they've put together good strength programs for athletes, looking at how they run when they run on the treadmill and trying to improve their gait, improve their strength in targeted areas. So I often find that that's helpful for athletes to go see someone like Tim or Ben and have them really analyze your gait and see if there's anything that they can do to help prevent or heal you from an injury.
Yes, I agree 100%. Thank you. So we'll sometimes treat a more acute injury. So someone is having something that's come up and keeping them from being able to run or to run to the extent they want to. Sometimes people will come with just more chronic issues where something is more nagging and they're able to do everything they want to do, but they feel like they shouldn't have to deal with these issues. And then the third would be more performance. So, a couple of people today have said they can't seem to get over the hump of a certain distance, or maybe cut their times as much as they want to. And so we can look at some of the things we talked about today, their strength, their flexibility, their running efficiency in their gait pattern, and assess those things and help them get to where they need to be, whether it's running pain-free or performance-based.
Yeah, and if you're looking to get one of those gait analyses, Tim and Ben Galeka both work at T3 in Avon. So if you're looking to get that done, that's where they're both located. A question here about whether long distance running can cause increased prostate stress and issues in men.
Ben?
No, I don't know a lot of information about that, to be honest. So I don't want to dive too much into that.
All right, we'll let that one go. Consult your doctor. Another question here about icing versus heat therapy. When is each of those appropriate?
So generally, what I recommend is, acute inflammation, injuries, ice is usually the way to go. Ice is it's actually very good analgesic. It's better than most pain medications to kind of calm things down. But if it's more of a chronic tight, kind of a chronic tendon pain or chronic muscle pain, usually heat works a lot better in that situation. So that's usually kind of the guidance I give my patients.
All right. Any closing thoughts from anyone? We're done with the questions, and anything you thought we might have covered that we didn't get to? Any final thoughts for people looking to run the virtual marathon this year in Cleveland?
When I thought about doing, if I was doing the race this year, I think one of the key things is just planning your route, planning, like we referred to today, the availability of water and other like carbohydrate drink. It's harder when you don't have that rest up every 2 miles that provides water and things, and so you have to map your route. And currently with our situation, you're not going to be able to go to maybe all the water fountains that you would normally go to along a run, or run into a place to a water fountain to refill your bottle. So really being more strategic with planning your route for this this event, that it's virtual on your own and self-supported. So either having someone, either you plant a bottle out on your route a couple different spots along the way, or have a family member who you've social distanced with be able to pass off a bottle to you. Or I think what I would do is I would do the routes that I know, like a 12-mile route back to home and refill a bottle there, and then do an 8-mile route and my 8-mile route and back to home and refill a bottle, and then the 6, or just some way that you have that you're able to get what you need to be able to complete that distance safely.
And I do know some runners who will, when they want to do a longer run like that, who will take extra bottles and plant them along their route ahead of time. They'll drive out, plant the bottles so that they know where they are on the route, so that they can pick it up on their way, so they have fresh water.
All right. Well, Dr. Amanda Weiss Kelly, Dr. Ben Boswell, and Tim Pugliese, we appreciate all your time. Thanks so much. It was very insightful.
Thank you.
Thanks for having me.
Thank you.
All right, just a reminder for everyone tuning into the webinar, uhsports.org is where you can find information about UH sports medicine. Remember, if an injury occurs before or after you run, or you need a physician referral or for non-emergency related issue, here's a person you can call. It's Lisa Piazza. She's the UH Sports Medicine Operations Director, and there's a number on the screen, 216-877-9736. This is a dedicated call service for Rite Aid Cleveland Marathon participants. Also want you to know that walk-in orthopedic urgent care for strains, sprains, fractures, knee injuries, and more is available at the UH Orthopedic Injury Clinic. You can find that at uhhospitals.org/orthoinjury. There are convenient locations in Beechwood, Chardon, Parma, and also in Sheffield Village. And finally, if you have any questions about the Rite Aid Cleveland Marathon, the virtual race, or registration questions, you can go ahead and send those to joan@clevelandmarathon.com or cmi@clevelandmarathon.com. Thanks again for joining us.